Doctor, now let's move on the next question from our audience.
Sure.
So Mithun is a doctor, so he want to ask some question to you.
Sure. Hello. Yeah. Thank you.
Yeah, I have a question regarding my uncle. He's a 40 years old. Okay. He has never smoked and is still having a lung cancer. Why? And what is the difference between the lung cancer causes by smoking and other types?
So good question. Unfortunately, the lung cancer can still happen in people who do not smoke. But I want audience and people who are listening to this to remember one thing. Smoking is the number one reason for lung cancer. See, almost 95% of all lung cancers are caused by smoking. So if you do not smoke, the chance of you getting lung cancer is extremely low. That's like 1%, right? So it looks like your uncle is in that 1%. So we do not exactly know what causes these people to get lung cancer even if they don't smoke. But there are some theories out there. For example, obesity can increase lung cancer risk and other cancer risks. And two is secondary hand smoking. If somebody is smoking around you at workplace or at your house, you are exposed to the smoke, then you could still get cancer. And there are other things we can, think about. But, if you have a lung cancer, but you're not smoking, the good news is, like in your uncle, if we test his cancer cells for some special mutations, 50% chance that he'll have some mutations that we can target with a pill, like EGFR mutation, ALK mutations, or ROS ROS mutations, and NTRK, and there's several of those, BRAF and others, right? So when you have this mutation, and mainly these mutations are present in lung cancer people who do not smoke. If you're smoking, the chance of having these mutations is really, really low. So why I said that mutations is if you have one of these mutations, there are excellent pills that your uncle can take for his lung cancer. He doesn't need to take chemotherapy only. So that's the difference. And two is the lung cancer that happens in smokers is different because they have lots of smoking on their lungs and then they got the lung cancer. Those people need chemotherapy and they do not carry these mutations that we can target with the pill. So the outcomes are not as great if you have a cancer and you are a smoker versus you have a cancer but you're not a smoker. So lung cancer is different in people who do not smoke. And they have a lung cancer called lung adenocarcinoma. And these cancers have these special mutations in half of the cases. And they do quite well. Even a stage 4 lung cancer patient, if they have a mutation called ALK mutation, if I give a pill, they can live even 5 to 6 years and beyond.
Okay. I got you. I got my answer, doctor. Okay, even in future, how I can connect you directly? Because even I have so many questions regarding my uncle because he's suffering. Now you have informed me that due to the passive also we get the lung cancer, right?
That's right.
Then how we can avoid those all the things like how long it will be take for the medication, everything?
So if you're asking about the treatment medication,
Yes.
so again, let's say your uncle never smoked, you said, and he has this lung adenocarcinoma, let's say stage 4, and he has this mutation called EGFR mutation, right? So if you do have it, we try to give them a pill plus or minus chemotherapy. So that pill will start working as early as in 6 to 8 weeks. And the spots in the lungs and other areas gets down and decrease in size, and he will feel better. And then he has to take this pill every day. And on average, people do quite well on this pill for 2+ years. And at 2 years, if the pill is not working anymore, we will change the pill to some other pill, or at that time, you could try chemotherapy or immunotherapy. So I have patients who live 5+ years for stage 4 lung cancer. Not everybody lives 5+ years if they have this mutation. At least 5 to 10% of patients I have live beyond 5 years if they have an immunotherapy marker or this target.
Okay, okay, doctor. Thank you so much.